Good afternoon. I'm Dr. Shawana Tucker, and I am the Chief Talent Officer with the State Department of Education, and I'm very pleased to be here this afternoon. Last week, as many of you are aware, Governor Lamont launched the Step Up Connecticut initiative. And as we all know, today is Giving Tuesday. Today, you're going to hear from a superintendent and 2 young adults who have returned home to serve their communities. And we hope that you will be inspired by their messages and what they have to share with you today. And we hope that other districts around the state and other healthcare providers will take note, and persons who want to step up and serve their communities as we welcome that during this ongoing pandemic. It is my pleasure now to introduce Dr. Fran Rabinowitz, the Executive Director of the Connecticut Association of Public School Superintendents.
Good afternoon, everyone, and thank you, Governor, for launching this initiative. I absolutely believe that there are silver linings in COVID, and one of them is all of the people coming forward to volunteer to work with our students in the schools. We know how incredibly important it is for our children to be in school right now, our youngest especially, and we are doing everything in our power to have those children in and have adults work with them, and these wonderful college students. I can't tell you the difference it makes in a child's life to have an adult that is especially assigned to them to be with them. And also, as we have the issues that confront us with COVID and teachers are quarantined, to be able to bring in volunteers to work within the schools while the teacher teaches remotely from home is amazing. And I'm inspired by the number of people that have come forward to help us during this time, and not help us, to help the children of Connecticut. So thank you, Governor, for putting this forward, and thank you all for making the children of Connecticut a priority. It is my pleasure and honor to introduce my colleague, Dr. Jeff Solon, the Superintendent of Cheshire, Connecticut.
Thank you very much, Fran, and thank you, Governor Lamont, for giving us the opportunity today to speak about this. What we've done in Cheshire, I think, provides a great roadmap for other communities to reach out to their recent graduates, and the State Department of Education, under these unique circumstances, has provided access to these students, these recent graduates, to substitute in our schools. And as Dr. Rabinowitz said, the need now is great. There's no replacing in-school and in-person learning for our students. So any steps that we can take to make that possible are welcome. And there are so many talented recent high school graduates out there who have a lot to offer, particularly for those that are home from college or have breaks in their schedule, to be able to contribute. And the Governor's Step Up initiative is the perfect opportunity and call to action for those kids in Cheshire and also for those young adults across the rest of Connecticut. So we're really excited that our students, our recent graduates, have decided to contribute, and given the fact that we only asked of them on Wednesday if you would be available to come in and substitute, that we had 35 applications by Monday, it really speaks to the commitment of our younger population across Connecticut and what they can do for our younger students. So with that, I want to pass it off finally to Governor Lamont. Governor?
Hey, thank you, Jeff. I forgot that this is a time of year where many days have a nickname, that Thanksgiving is followed by Black Friday, which is followed by Cyber Monday, and today is Giving Tuesday. And I'm reminded of that. There are a lot of different ways you can give back to the state. We have 4CT, an amazing philanthropic effort. You can go online there, raising money, what they've done for food insecurity, what they've done for testing, and Step Up Connecticut. Step Up Connecticut, as you know, is a way that young people or all people can get involved. It starts with the volunteers we had early on when it came to getting folks there at Rensselaer Field to help distribute food to folks who are in need. It followed up with Election Day, where we had hundreds of people step up and help in terms of the poll workers and the such. A lot of whom were older. We needed to get younger there so we'd be able to do that safely. We've done a lot in terms of we need additional help when it comes to testing and track and trace, some of which we've talked about before. We have the Medical Service Corps with hundreds of people there able to aid and assist in the time of emergency. But today we really wanted to talk about our schools. And I am so proud that compared to all my neighboring states, Connecticut, your child is more likely to have an opportunity for in-classroom education than just about anywhere else in the Northeast. And as you heard Jeff and Fran, Shauna describe how important that is, especially now for these young people in terms of their education, in terms of their social and emotional well-being, in terms of public health. And we cannot continue to do that. As I look around the charts, I look around all the different towns, I see if schools are closing, it's not because kids don't love going to school. It's not because their parents aren't delighted their kids are able to go to school. It's not because we don't have a lot of amazing teachers who are stepping up in the classroom, but it's because, let's face it, sometimes there could be an infection or a test and you've got to quarantine, you've got to step out, you're an older teacher, you've got to step off the battlefield. So we have an awful lot of teachers who are still involved. They're teaching remotely, they're teaching via Zoom, but that means we've had some holes in terms of staffing in our classrooms, to be blunt about it. And a number of the schools that I've seen that had to close down because they could not fill that void. Well, Jeff, you didn't wait for Step Up Connecticut. Cheshire stood right up. And what Cheshire has done and what we're trying to do around the state is they reached out to Cheshire High School. And they said, I want to know who are the recent graduates. Many of them are college kids. They're coming back to Connecticut. Maybe they got some time. Maybe they'd like to step up and help us out. And they got 35 folks who stepped up in very short order of time, getting them into the classroom, being there so that certified teachers teaching remotely, and you've got young people and others in the classroom able to give these kids an opportunity and what that means. That's why we really want to emphasize what Step Up Connecticut can mean, follow the lead of Cheshire, and it's really my great honor now to introduce to you Isabel and Jack. And you two have stepped up in a big way, and you have just a very humble task to come up here, talk to the people of Connecticut, talk to your peers, tell them what you did, why you're doing it, what it means to the students in the classroom, and see if we can generate another 500 folks just like you. Come on over.
First off, just wanted to thank Governor Lamont for having us here today. So for me personally, when I got the email from Dr. Solon, I knew I had to jump on this opportunity right away for a combination of reasons. I think one, from an early age, I knew that I wanted to help kids. Having two parents who are in education, I was able to see early on, just kind of growing up in that sort of environment, that helping kids is something that was something that I wanted to be a part of. And then also too, growing up in the Cheshire school system, I knew that from early on, I looked up to my teachers, administrators, coaches, and everyone in the Cheshire public school system as role models and mentors. So to be able to give back to a community that's given me so much, I knew this was an opportunity I had to jump on.
Jack, just say your last name and spell it.
Raba, R-A-B-A.
Good afternoon. My name is Isabel Orozco, and I'm really, really thankful to be here today. And I want to thank the governor for his initiative, which is incredible, and I really think is a fantastic opportunity for students to give back to their communities. And that's something that's very meaningful to me personally. And I'm also very thankful for Dr. Solon for having us here today. So I also grew up in like a teacher household. My mom was a teacher, and so she really inspired me in terms of, you know, what it means to be a teacher, what it means to be a leader, educator. You know, the word teacher is very loaded with lots of meaning, and that's something I also personally learned in high school. I don't know where I would be without the community that I had at Cheshire High School, without the educators that I had at Cheshire High School. Truly, like, there has been so much that they have done for me, and I feel that it is my moral obligation to, you know, assist in such an uncomfortable, turbulent time, because, you know, I graduated last year, so I understand how crazy it was when we made the transition to remote learning, and I can't even imagine the amount of stress that is put on teachers as educators, because, you know, teachers are definitely expected to be as normal as possible, even though these are absolutely abnormal times. So I feel that it is very important for us to support our teachers as much as we can, as much as they supported me and as much as they supported the entire community. So that's exactly why I feel this is an amazing initiative, and I'm glad to be a part of it. I also was lucky enough to serve on the Board of Education my senior year as a student representative, and that gave me a big perspective on the way that the education system works and what it means to really be dedicated to it. And you know, it's something that I have become passionate about, because education is truly a gateway to so much more, and it's important that we inspire kids to really take advantage of what they're given and understand that they can accomplish anything with education.
Isabel, spelling of your last name, please.
Orozco.
Thank you.
Any questions for these guys?
Yeah, maybe the student have anything come up to you. Can you explain how the Cheshire program works?
Yeah.
What qualifications do you need to have? How old do you have to be? What does it take you?
Sure, the State Department of Education put in a provision during the pandemic to allow those who do not yet have a college diploma but have a high school diploma to apply to be substitutes. So what we did was reach out specifically to Cheshire High School graduates who are incredibly familiar with the community, with the school system, with the buildings, with the staff, and asked if they would be interested in stepping up to help out. And as I indicated before, there was great response to that. We had 35 immediate applicants over the weekend, Isabel and Jack were two of those, really outstanding students and people. So we are now working through the process. They have to have a background check. They have to have all the same training that we provide to other substitutes before they enter the classroom with our students. And so that in that way, they're much like everybody else with 13 years experience, though for many of them already in our schools. So that's a unique wrinkle. Yes. Yeah.
Substitute for teachers who are teaching remotely because they're under quarantine or for some other reason?
They're predominantly going to be used to cover classes where a teacher's on quarantine but teaching remotely, but they can also substitute if the teacher is out for the day. They'll be provided lesson plans and support through a neighboring teacher to be able to cover the class for the day.
What was the shortage? What was your experience like?
Unfortunately, we've had to cover a number of classes with teachers using their prep periods or other time to be able to make sure that we can have our students in. In previous years, it wouldn't be uncommon for a school anywhere in Connecticut, if they're in a real pinch and the teacher is absent, you might have to divide those students into other rooms. You can't do that now. And so in order to maintain and safely operate our schools, it's really critical that we have a substitute population to fill that void and make sure that our schools are safe and our kids can be there. Sure. The need for substitutes this year is extraordinary because of the very appropriate CDC guidance around if an individual is exposed, if they're a contact to somebody who tested positive, then they need to quarantine for 14 days. If a teacher previously was absent or had a cold, you might be looking at 2 or 3 days out for the teacher. But now you can have numerous individuals, numerous staff out for 14 days at a clip. And those are really talented and thankfully healthy individuals usually that are home and not experiencing symptoms. And so we've leveraged technology to be able to put them in the room through a smart board and projection audio system, but we still need supervision in the classroom. So it's as close to being a teacher in the room without having to actually have the individual in the room.
And Jeff, I would think it's also great from the student standpoint to be able to sort of test drive being a teacher,
Yeah.
if you will, for a while to see if it's something they'd ultimately like to do professionally.
It's interesting, Tony, that a number of our recent graduates have said, is Jack and Isabel, you heard them indicate that Cheshire's given them a lot, and they want to come back and experience support the teachers that they grew up with, but also, as you indicated, see what it's like to be a teacher. And sometimes you get to college and what you thought you were in love with all along may not be what you really ended up in love with. And I think almost every adult can relate to that in some way, shape, or form. And so this is an opportunity to experience what it means to be a teacher. It may not be the best time to test drive being a teacher, but it's a way to experience it before you finish your graduation.
Have Isabel and Jack been assigned to schools yet?
Not yet. We haven't initiated the program yet. As I said, there's training that our substitutes have to go through. They haven't had the advantage of that yet. But once they do, we talked to, and I told all of the students that I wrote a letter to, that you'll have a lot of say in where you go, what age group you're working with, and what course content you're working with, because there's different levels of comfort, and we want it to be a good fit for our substitutes, but also for our students.
These kids are home until the next semester?
It depends. Some of the applicants, our recent graduates, attend school locally. Some are on an extended break because their college has an extended remote learning period. Everybody's circumstances when you have 35 people is a little bit unique.
But in that mix, are there people who are still doing remote
Jack and Isabel are two of those people that are still wrapping up coursework at their college, but are trying to find a day here and there to fill in.
Maybe Jack and Isabel, can you tell us how old you are, when you graduated, what schools you're attending?
So I graduated in 2018 from Cheshire High School, and currently I'm a junior at Wesleyan University in Middletown.
And are you taking classes remotely now?
Yeah, now that we're home for the holiday break, we're remote to wrap up the semester, and then we'll resume classes sometime in February.
As I said before, I graduated last year, so class of 2020 from Cheshire High School. I currently am a freshman at Wellesley College in Massachusetts. Oh, I'm 19.
Have you been remote, Isabel, or were you up at Wellesley?
I was up at Wellesley, and then I went home. So my classes have been remote for the rest of the semester. So. No, not in particular, but it's something that I've found passion in. I am, however, working at the Children's Center Wellesley has on campus, and that's really exciting because it's basically a preschool. I was actually planning on being a political science major. Yeah.
Congratulations, guys.
Thank you.
Thank you.
Governor?
You good?
After 2 o'clock, I'm guessing you have some numbers for us to share?
I guess I do.
Magic pocket.
It's 5.9% is the positivity rate for the day. That's 4.9% for the last week. Hospitalizations are still up, 54 in the last 24 hours, and another 20 fatalities. I look at New York, which is up to 5%, the highest that New York has been in a long time. So we still have a way to go, and we know that we're part of that New York ecosystem.
Governor, what do you think of the fact that the hospitalizations have not bent downwards while at least the 7-day positive rate, is certainly bent that way?
Yeah, I was talking to Jeff and Deirdre about that, or Josh and Deirdre about that. It's still a little early, but obviously I'd like to see that curve start to bend just like we saw the positivity rate. It's a 2 or 3 week lag. We do tend to think that people are spending less time in the hospital, less time in the ICU, so we'd like to see some positive news there soon.
Governor, I understand the meeting with the doctors group has been pushed off to later today.
Yeah, I don't know if it's been pushed off. I think I'm going to go right from here to there.
What do you hope to get out of that conversation?
Oh, look, I've been talking to the healthcare leaders every step I can, and these are folks on the front line. Obviously, they feel very strongly that hospitals have the risk of getting stressed. Look what's going on in Rhode Island right next door. So I'll be asking them in terms of what they're seeing, what we can learn, and they're saying, probably going to ask me, why don't you close down more stuff?
How many people are participating?
I think it's about 15.
By Zoom?
Yes.
Speaking of, you mentioned New York, I think yesterday Governor Cuomo said that New York State would roll out emergency restrictions in response to a severe spike in COVID hospitalizations. And if hospitals reach capacity, he would order a regional shutdown. Do you have any plans of that sort? And Rhode Island seems to be doing something similar as well?
I think we're going to work more on a statewide basis. He's got a regional basis. He's a much bigger state than we are. I do notice that Erie, one of his counties, they said no more elective surgeries there. So there are a variety of ways that he is expanding capacity in his hospitals.
That still has not been done at the hospitals as far as you know?
No, we didn't do it in the spring, and but frankly, Paz, I mean, a lot of people stopped going in for electives at a certain point. So we're watching that, And if that happens, that obviously frees up capacity and more importantly right now, frees up nurses and docs.
Governor, the doctors are asking for you to consider closing down gyms again and restaurants just going to takeout only. Have you received indications from public health that these places are harboring and increasing, if you will, the spread of COVID, these sorts of businesses?
We haven't seen that, Tony, on our track and trace to date. We do know that our restaurants have been open since, June 20th for indoor and even earlier for outdoor dining. We do know that we had, very low infection rate for many months. The difference now is if you get more community spread, how does that change the dynamics in an indoor venue like a restaurant and a gym? We lowered the capacity of our gyms to 25% and wearing the mask. And as you probably saw yesterday, we're finding a lot fewer people are going to restaurants, period. So not sure that we have to do anything, and we're doing everything we can to keep them open safely.
With regard to the remaining federal money that you have at your disposal, any idea, does it have to be spent by the end of the month? Does it have to be allocated?
Right now, it has to be spent by the end of this month, by December 31st. So a lot of those really small states that got so much money, they're scrambling right now because everybody thought the Congress was going to extend the period of time. We're not in that situation. Melissa McCaw, budgeted this out pretty carefully through December 31st.
Any ideas what items that money will be allocated to through the end of the month?
We've done some for not-for-profits. We've done some for, the small grant program. Obviously, we're doing 15, 20 million a week on testing. That's quite expensive. So that's all coming out of the CARES Act money, allocated at least through the end of this year.
The Restaurant Association may have renewed its request for the state grant program for restaurants. Anything new in your position on that request?
I don't think so. I mean, there are a long line of people who are looking for a bailout, and there's only so much the state can do. We've done a lot. We put in place the short-term bridge loans early on until they got the PPP money going forward. Just in the last week or so, we've handed out $5,000 grants to 10,000 different small businesses. And believe me, if anybody can find a way to generate a little bit of extra, Melissa McCaw can do it. We'll see what we can do between now and the end of the year.
Is your sense that we're headed for a new high in terms of hospitalizations? The high, previous high was 1,972 on April 22nd. Here we are, we're over 1,100 in the second wave. It's not expected to compress until mid-January, second half of January. Are we going to see a new record in terms of daily hospitalizations that we set at one point?
I think we're going to know a lot in the next couple of weeks. We're going to know what was the impact of universities going home, coming back. What was the impact of Thanksgiving? I was pretty hopeful there. We brought our average weekly positivity rate down by a fair amount over the last 10 days, 2 weeks. Can I get back to you in 2 weeks? I think the CARES Act money has all been pretty well allocated, to be blunt. So that's why we need the feds, because we've got a lot of administrative costs related to getting the vaccine out. It's coming out on December 14th. We've got to get going on December 15th, at least for the Pfizer portion of that. So I'm meeting with, talking to Melissa and Bob about what we maybe can do with a rainy day fund, waiting to see if the feds are going to step up and make it easier for the states to get the vaccine out there. I mean, they worked so hard and they spent so many billions and tens of billions of dollars on Operation Warp Speed, and they're going to stop right when we're in the finish line in terms of giving us the support we need.
I saw a report that said you still had a significant portion, $192 million to allocate
That's inaccurate.
Can you follow up too on your thoughts? CDC advisory group is meeting today to discuss priorities. Is there anything that you think would be a priority here in Connecticut if they don't make a national grid for you to follow?
One priority, I'd love it if they make up their mind on the quarantine period. We're just talking about the 14 days. Europe, you know, is 7 to 10, and I know they're thinking about that. But more broadly, look, Vice President Pence has made it very clear, at the end of the day, it's the states who are going to make the call in terms of what is prioritized. The CDC will give us some guidance, which I take to heart, and that includes, obviously, our frontline responders in the hospitals, nurses and docs, those who are the most vulnerable, including those in the nursing home. A lot of reasons for that. A, to keep grandma and grandpa safe, and B, so they don't have to be in the ICU, and it frees up capacity there as well. And finally, we'll be looking at first responders, doing everything we can to make sure they're safe, because we need them every day.
Would you consider a janitor one of those frontline workers? Because we've heard experiences where folks have gone in and gotten other people sick.
Let me ask Deirdre's group. They're taking the lead on that.
Thank you, Governor.
Thanks, everybody.